Slide. All right, so welcome to our August Teach Educational Rounds. Here with us today, we have Dr. Tricia Tillich, who will be presenting on clinical interventions for youth and vaping. So another highly anticipated session on youth and vaping today. I'm going to go ahead and get started with KMH's land acknowledgement. KMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of KMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. KMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. Now, we'll go to the next slide, and I'll invite everyone to introduce themselves in the chat and let us know which traditional territory you are joining us from today. If you're not sure, I can put that link in the chat for you to find out in a second. And you're also welcome to let us know something that you are doing to learn or improve your commitment to reconciliation. So for those joining for the first time, my name is Natalie, and like KMH, I am also located on the lands of the Mississaugas of the Credit. As a white settler, I'm eternally grateful to be able to continue to learn, work, and play on these lands. So I'll give everyone a few moments to share in the chat. And Tricia, in the meantime, I don't know if I can't see your camera, but I don't know if you're having trouble on your end with.
Are you able to hear me, Natalie?
Yep, we can hear you.
Yep, I'll see it. I'm not sure. Figure out the camera piece.
Sounds good. I'll give everyone a few moments. Thanks, Kristen. Welcome. Okay, in the interest of time, I will continue on with some housekeeping items, but thank you for sharing in the chat. We love to see your comments. So for those interested in receiving a letter of completion for this Teach Educational Rounds, please make sure you have registered for the webinar and completed the free learning assessment. So we can, and then also sign into the webinar using your full first name and last name so we can track your participation. And last but not least, please make sure to complete the evaluation and post-learning assessment. That will be emailed to you by tomorrow, and you'll have 1 week to complete that. So we'll go to the next slide. So now I will introduce our presenter today. Today we have Dr. Tricia Tillich, who is an adolescent medicine specialist at Sick Kids Hospital in the Division of Adolescent Medicine and an assistant professor in the Department of Pediatrics at the University of Toronto. After her training, she completed a clinical fellowship in addiction medicine here at KMH, where she currently provides consultation within the nicotine dependence clinic. She has a clinical focus on youth tobacco and vaping cessation, as well as improving access to care for young people with concurrent substance use and mental health disorders further complicated by chronic illness. So welcome, Trish. And just a note on her disclosure, so we'll go to the next slide. So just a couple notes on some grants that are vaping-related research from CIHR, Sick Kids Lung Health Foundation, and the Canadian Public Health Association. As well, we'll go to the next slide. Just note that all eligible Teach Educational Rounds presenters are offered honorarium from the Teach Project for their time. However, presentation content is not affected by acceptance of this. We'll go to the next slide. So please know that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. Nevertheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So with that, I will hand it off to Dr. Tillich to take it away. Thank you, everyone, and enjoy the webinar.
Thank you, Natalie. And sorry again, also on my part, just a few technical difficulties, but I think we're going to be okay for time. So again, the title of this talk today is Clinical Interventions for Youth in Vaping. And in terms of the objectives, we'll be examining the changing context of youth and vaping. We'll describe the clinical interventions, strategies tailored to youth who vape, and we'll identify current evidence-informed provincial and national programs. With respect to the agenda, so in addition to these objectives, what we've attempted to do is provide some testimonial from a treatment-seeking high school student, as well as a parent of a grade 8 treatment-seeking youth. And we'll have an opportunity for question Q&A towards the end of this presentation. So just to start, what we hope to do is have or establish just an understanding of your practice. So just wondered if within the chat, if you could answer the following question. What proportion of youth and or young adults are you seeing weekly within your clinical setting? So if it's less than 10%, you could just rate A, or less than 10%, B for between 10 and 25%, 20 to 50%, and greater than 50%. Okay. So far, I see a number of more around less than 10%. So it's helpful to note that. And that will be relevant as we continue this talk. Thank you. The second question, what proportion of youth and young adults are seeking treatment? So of those who you are seeing in your clinical setting, what proportion of those youth are seeking treatment for vaping and or smoking cessation? So less than 10%, between 50%, between 10 and 50%, greater than 50%, or these youth are not seeking treatment for vaping or smoking cessation. Oh, quite a range, actually. Okay, helpful. Okay. So given the changing context, I think this will definitely evolve for a number of you who are seeing young people who are presenting with concerns related to vaping and smoking. This first objective is meant to examine the changing context of youth in vaping. So from a global perspective, we know that the rates of e-cigarette use among Canadian adolescents are among the highest globally. From our national standpoint, the most recent data here is from the Canadian Student Tobacco and Alcohol and Drug Survey for grades 7 through 12 students. So roughly 30% of these high school students reported trying an e-cigarette, and about 8% reported vaping nicotine daily. So we're fortunate to be able to report on the Ontario Student Drug Use and Health Survey, which I think a number of you are aware that this is the longest running survey, and it is out of the Centre for Addiction and Mental Health. And the data from 2023 indicated that 13% of grades 7 through 12 students reported past year use with respect to vaping. So when we look at this data, what is important to continue to consider is that this data reflects the student population of, so the total story of students is roughly about 10,000 students in grades 7 through 12. And this cohort represents 46 English and French public and Catholic school boards. Parental consent is required. So this potentially could be a barrier in terms of those who participate in this particular study and survey. And there are a number of exclusions. So schools in First Nation communities, military bases, hospital, so Section 23 schools, and any other institutions, private schools, special education, standalone classes, including ESL classroom settings, students that are homeschooled, so students that are not attending school, of course, those who may have unstable housing, and those youth who are incarcerated. So I mention that because I think it's important to understand that this data is absolutely important from the standpoint from a provincial lens and thinking about trends, but it certainly does not capture the breadth of data that could be informative in terms of how we consider interventions or consider this population of youth who are using substances, but specifically for this talk, vaping and smoking cigarettes. The other thing to note is if you look at the top, so we have so these are the top 10 substances here. We note that vaping, so e-cigarette use, tobacco cigarettes, water pipes, smokeless tobacco, and I also include cannabis here as well. But this is really the majority of, or 50% of these substances within the top substances that are reported among high school students. So the majority do include nicotine. Cannabis is included here just if anybody is curious, because a number of youth who do use cannabis often report that they combine that with cigarettes. Okay. When we look further with respect to the vaping data, so again, this is the provincial data. In the past year, for those young people who vaped, majority, so 87% reported vaping nicotine, 43% reported use of or vaping before grade 9, and students who endorsed tobacco cigarettes as well as those who vaped reported that friends were really the most common source when we think about access to these products. So this is a testimonial from a high school student who is treatment seeking, and it speaks to the access to vaping products. So I might need to look to Natalie. Okay, thanks.
I think there's way too much access for kids these days. I really don't hang out with kids that vape anymore, but even a year or two ago when I did, the access was like you could go anywhere. Anybody knew at least one place that would sell vapes, and you just need to know one corner store that'll sell to kids, and that spreads like wildfire. Every kid then knows where to go. Every kid then knows where to buy some vape products. And I feel like that really makes the difference because there's times where yes, we know where the vape stores are, but they do respect their rules and they will not sell to you unless you have an ID or you're over 19. So I feel like it's really these corner stores that don't care and just want money that make it really easy for kids to find vapes. And like I said, the culture at school, every kid has a vape. You can just ask a friend, and that friend would probably know at least one or two people that have a vape. So it'll only take a matter of a couple hours to find a vape if you really want one.
So I think this is a really, I don't think we could get a better explanation as to how young people are accessing vaping products. And I'll just share my slides once again here. Okay. So the other really important point here in terms of the changing context is that it's also the types of products that are available that are nicotine containing. And I think probably a number of people are aware of the flavored pouches that have been approved by Health Canada. The emergence of these flavored pouches have occurred at a time where we're really trying to do our best to address vaping among youth. And many may also be aware of the Ontario Minister of Education's announcement with respect to the vaping ban in schools that would include the installation of vape detectors, security cameras, and young people who are caught you're using or vaping in schools would acquire an associated fine or penalty, and their vape devices would be seized. So the thought here, at least from the standpoint of intervention, is that this may help to potentially address the concerns related to vaping. But from a clinical standpoint, one of the things that I think we often consider is the downstream impact in terms of potentially seeing an increase in health-related visits for potentially those youth who are treatment seeking, for those who may be concerned with respect to nicotine withdrawal. We may also see parents, guardians, or even potentially staff within schools who have encouraged or would like a young person to be seen for vaping or nicotine use-related concerns. So that the context really continues to evolve and shift. And so we really need to consider these factors when we think about how we might intervene and the strategies we may use as we tailor these strategies for youth who vape. So again, this young person speaks to the challenges and what he has and his peers have found not helpful in terms of reducing or quitting vaping. Thanks, Natalie.
Simply not able to. Well, there were many things that I found that were not helpful, but the most were people that I hung out with and the vape products themselves. It's so clear that all vape products are targeted towards teens, and I would even say as young as 10 or 12 years old. Names like Strana Banana or Unicorn Vomit should never exist and are only made to attract kids. Some kids at school would not even be into vaping, but others would have flavors like Straight Jacket, which would make the kids who didn't even vape want to try. So stupid names was really one thing I noticed that kept many people away from even the idea of quitting, just finding new flavors that every day that they could tell their friend that they had. Other things that made it hard was the culture behind vaping. I remember in grade 9 before COVID, in all three boys' washrooms on all floors, there would be 10 to 15 kids in each bathroom passing around a vape. So it was like almost impossible to walk into a washroom and not feel the need or want to do it, because like it's widely known that most humans are sheep and will do anything that other humans do, so they don't want to feel like outcast, and this behavior is increased in kids. Some strategies I found that were not as helpful to quitting, for me at least, was reducing your nicotine level. For example, going from 5% nic down to 20 or 2, then 10, then 5. That really never worked for me. This never worked for me because most people I know that tried this either got stuck on 20 or just went back to 50 nic. So, and for me, it would have never worked anyways. But by far the least helpful thing was my friend group. Having good or bad friends can really make a difference. If you're trying to quit and you let your friends be aware of this, good friends will support you and stop vaping around you if you also vape. The people I hung out with couldn't care less if I was trying to quit or not, and it gave me the same mindset that they had, that it's just vaping, it could be worse, which was partially true because I was doing some more dangerous substances at the time, but it was these same people giving me those substances. So it really, what I'm trying to say is that having a good friend group will make it 100% easier to quit in certain times. And that if you ever work with a kid who seems to be very passionate about quitting but can't seem to do it, it's more likely than not that their friends don't really care about them or something's wrong with the friend group.
I personally have found that that account of this young person's experience so helpful in terms of understanding how to target some of the approaches that that we often consider. And I think the primary take home is this developmental aspect where we know that it's normative for young people to shift towards their peer group during their adolescence. But in that moment, where they are making these decisions about who may be a part of their peer group, we can see how much of an impact this can have on a young person when that peer group is in fact endorsing and supporting, in this case, vaping or maybe behaviors that are riskier. So I think he said it best, but I think when we move forward, we think about the interventions, really to keep that top of mind as we consider approaches that we might utilize or we might suggest for young people who present, particularly those who are treatment seeking. So I'll share my slides again. Okay. And I should just also encourage questions that you certainly if we could add those questions to the chat as well, because we'll certainly go back towards the end and do our best to review all the questions that may come up throughout this presentation. So with respect to the clinical interventions, we do have some guidance and endorsement from a number of associations. And when we think about vaping cessation specifically with among youth, the first line intervention is behavioral therapy. So psychotherapy, behavioral approaches and strategies, examples being that one-on-one counseling or group counseling apps or web-based programs, text messaging programs, coaching helplines for cessation support. And this is supported by pediatric organizations such as our Canadian Pediatric Society, as well as the American Academy of Pediatrics, as examples of organizations that do support these recommendations. So if we are moving forward then and thinking about if there's a need or indication for NRT, we also have an endorsement from a number of associations in terms of being able to offer nicotine replacement therapy in addition to the behavioral interventions for vaping cessation. What's interesting in terms of the literature is that there is some literature that looks at treatment-seeking adolescents, and this particular paper, which was published in 2021, looked at roughly about 1,500 high school students who reported vaping, and about 2/3 of those had tried to quit over the past year. And their report about the most common approaches included no resources in terms of utilizing resources for their quit attempt. But peer support, in fact, was actually at the top of the list. And I think, again, that's speaks to what we heard from the young person who discussed the barriers, the challenges with respect to vaping cessation. We'll speak more to the other forms of resources or treatment interventions further towards the end of this talk. But briefly to talk about what the assessment could look like and thinking about the time that you might have. I know that at the beginning when we asked about the number of young people that do present in your clinical setting, it does seem as though there may be fewer presenting at this point in time. So I do want to mention that going back to kind of thinking about this landscape of this shift with respect to the vaping ban, that you might see an uptick in terms of the number of young people presenting who are potentially treatment seeking or those who are maybe encouraged, so to speak, to present for support with respect to reduction or cessation of vaping. So questions that could be asked or should be asked are which form of nicotine is used. And I would like to emphasize that more and more I'm hearing about the use of nicotine pouches. And I think anecdotally, I've been hearing that among colleagues as well. How are they using the nicotine product? How often, how much, how long, when was their last use? And the last use here being helpful in terms of ascertaining as to more with respect to either withdrawal symptoms or their level of dependence, which we can assess further with tools. Their state of change and motivations. So why did they start vaping? Why have they continued? Are they ready to stop? And the readiness ruler, or thinking about, again, looking at the stages of motivation, whether they're pre-contemplative or contemplative or in an action phase. These are really important aspects to the assessment as you consider how you might tailor your approach. Tools that can be helpful, which I think a number of those who are joining today may be familiar with. The CRAFT score and the CRAFT tool, the most recent version, actually includes the Hooked on Nicotine tool, which allows for there to be further assessment with respect to nicotine use and nicotine dependence. But the craft tool alone is 6 questions, and as you score those questions, which I haven't included today, just in the interest of time, but the score does allow for there to be an understanding of the degree of severity or the problematic nature of the substance, in this case, nicotine use. And what is also quite helpful here as well is that this also has been found to correlate with, as there's an association or correlation with DSM-5 diagnosis with respect to substance use disorders. So again, as we see higher scores, we are more or increasingly concerned about the DSM diagnosis, either a tobacco use disorder or nicotine use disorder. The e-cigarette dependence scale is quite easy to incorporate in your clinical setting, given that it's 4 questions. You can score this, and a higher score indicates a higher level of dependence. Again, it's also helpful as a tool with respect to furthering the discussion with a young person. For example, I vape more going into situations where vaping is not allowed, and it could typically be contextualized to school settings, whereby this might be in a classroom setting, it might be in the bathrooms. And in this case, I think in the bathrooms, we might see again that this will likely shift. So overall, I think it's important to emphasize that more times than not, there is a concurrent mental health condition that may not be it may not be either disclosed, or there may be lacking in terms of assessment or ascertaining as to which mental health illness may be underlying or may be concurrent with the young person's presentation. And so again, important to screen for concurrent mental health disorders, and to encourage a young person to seek treatment or to initiate treatment as indicated. The education piece is very key to the treatment approach, and we'll hear more about this from the young person as he has some thoughts around what has been helpful, and behavioral interventions, which we'll talk about towards the end, pharmacological interventions as well, as we'll talk about NRT a bit further. But here is this young person speaking to what has been helpful, what he has found helpful, and also peers have found helpful with respect to reducing or quitting vaping.
Well, vaping was a part of my life for over 4 years, and it was one of the hardest things to quit. I'd like to one day to completely quit all nicotine, but I think quitting vaping is one of the first steps anyone needs to make if they want to quit nicotine completely. Nowadays, vaping is part of teenage culture, and it's probably harder to find a group of teenage kids that doesn't vape than a group that does. Some factors that helped me make my decision that I should quit was hearing the nicotine equivalents from a pack of pods to cigarettes, learning that one pod of 5% nicotine juice was equal to around 200 cigarettes or something around that really made me think about how much how much I should quit vaping. So that was one of the first things that really, and I think if more teens were aware of that and they knew that, they would also consider their choices. I tried many different things to quit, and only one thing really worked for me, and that was completely separating myself from anyone who was still vaping and using patches and lozenges. Everyone is different, but I simply was just not able to stop with others vaping around me, especially since I was using it for many years before trying to quit. The longer you have been vaping, I think the harder it is for you to try to quit. I knew some kids who were vaping for a couple months and they were just able to say one day they were going to quit and never use it again. But it's different for everybody. The second part that made it really easy for me, or the second part that I found that worked, was acquiring NRT, which is fairly easy for me since I was 18. But for teens 17 or younger, it can be challenging to acquire NRT since you would need an adult's permission, and most parents of these teens don't know. If you think you're a parent, if you think your parent would just punish you and would not try to help you, it's probably best to go to another adult you trust, like a school counselor. But most parents I know would be upset at first, but still willing to help. Being able to use NRT really made such a difference with reducing how much nicotine I was using and completely quitting vaping. Having support really made the difference when I was trying to vape. In my opinion, there's some NRT that works better than others. For example, I recently tried using the Nicorette 4 milligram inhalers and found that it actually did the opposite of helping. The juice inside the inhalers looks just like vape juice and tastes just like burnt vape juice. So it kind of brings back that feeling you get when you're vaping. I also found that it would give me a buzz instead of removing the cravings. This might also just be because I had not vaped for like 5 to 6 months before using the inhaler. So the fact that I already had stopped vaping for so long, maybe it felt like it was doing the opposite. But for someone who was trying to quit vaping and the first thing they use is the inhaler, I could see how it could help. To get the best results, I would distance myself from other people who vape while also using NRT. Other people may be able to hang out with people who vape and use NRT, but I was simply not able to.
Right. So again, I think really helpful to hear that perspective. I did see a question in the chat, and I'm hopeful that we can answer that question with respect to that conversion, which the young person alluded to. So, education as being one of the points that were made around what was helpful. And I would say that that's definitely a part, a probably a bigger portion of the intervention, sorry, that I myself incorporate within my clinical setting. And the young person's actually referring to this conversion whereby so we'll take the example of the pod, so the Saruran pod, which is the one that's towards your left and my right, where it is approximately 90 milligrams of nicotine once they've calculated the amount of nicotine within the pod, and the conversion being 1 to 1, being the equivalent of 90 cigarettes. This is from Stanford University. They have a pretty comprehensive tobacco prevention, vaping prevention and cessation resource. And this is specifically from their tobacco prevention toolkit. So it's one example of where I think it's pretty well depicted here, or well illustrated as to this conversion. I'll speak to a few caveats in a moment, but I also think it's important to note that there are other ways that this has been kind of illustrated and depicted. This is from the University of North Carolina, where they've looked at the equivalent number of cigarettes and also the equivalent number of packs of cigarettes. And they've used the various forms of vaping products, such as the disposable products, pods, and they've also incorporated the e-juice here as well. And what the young person has mentioned is that there was a lack of or no knowledge of this conversion. And I would say that a number of clinicians, in terms of the discussion around, is this an accurate 1-to-1 conversion? And from the literature to date, particularly for the jewel pods, there are a few papers that do speak to this conversion. However, that being said, there are a number of different products, and the best that we have is this equivalent. However, we could look at, and I think there are a number of sites that are looking at, really testing the product to be able to acquire that conversion. And I think, I mean, from a utilization standpoint, maybe from a resource perspective, that isn't probably maybe the ideal use of resources, but from the standpoint of being informed and understanding what young people are consuming, we know that this information could be and is very important. And certainly for this young person, it was what he reported as being a key factor in terms of how he has shifted with respect to the motivation towards cessation. So we can speak a little bit further to this in terms of the and how you can incorporate this within your clinical setting. What's key to being able to acquire this conversion, or to be able to understand how much nicotine is within the product, is knowing the information which is typically on the product, the packaging. And most young people do not carry the packaging on their person. They may have actually thrown out the packaging. So I often ask I'll ask if they do have the packaging, but we usually look up the product online. Once we're aware of the strength, so the nicotine concentration, which typically at this point in time, majority of youth are using the 20 milligrams, so the roughly 2%, and the those who are using the 50 milligram, it's a bit rare to see this now, but there was a time where we were seeing this, particularly with Stealth. That's the one product that I heard more about. And so at the end of the day, understanding and knowing what that concentration is key, and then knowing what the volume is for the product that they're using. So we'll give an example here. I just thank you, Debbie. You've just mentioned that's exactly what I was going to mention, is that if you look at the device or the product, oftentimes there isn't any information about this, these details, which is, of course, misleading. And usually when we do this calculation in clinic with patients, and clients, they often do reflect on that, that they have no idea, because it also it's not labeled on the product as they're using it every day. So this is an example of a pod, which from a volume standpoint has 2 milliliters. And from a nicotine concentration standpoint, as you can see from the label, has 20 milligrams per milliliter. And so from a calculation perspective here, and I apologize, I still had 50, I meant to change that. I do apologize. It should say 20 milligrams per milliliter, so we'll make that change. And so when you do this calculation at 20 milligrams per milliliter times 2 would actually be 40 milligrams per pod. So I'll go back because I don't want this to be confusing. But if we looked at 40 milligrams, so if it's 20 milligrams per milliliter and there's 2 milliliters in each of those pods, we would have a total of 40 milligrams in that 2 milliliter pod. And then if you look at the diagram here, so this is for the jewel pod, 1 jewel pod here, just from the perspective of looking at the amount of cigarettes. Again, I sometimes find that helpful to be able to show that from a diagrammatic perspective as well, in addition to the numbers. I'm going to pause here because I know that there have been a number of questions with respect to this conversion. So I do think just taking a minute or two to ensure that if there are any questions, that I can try to answer those in this moment. And if not, we can continue with the content and come back to this. Oh, Debbie. Hi. I don't think I can hear.
Debbie, if you're able to put your question in the chat, that would be awesome.
Yes, yeah.
Okay.
Absolutely. Yeah. I think there were questions about the copy. Can you include the link to this diagram? Absolutely. Oh, okay. I think an attempt to unmute. Maybe I'll proceed and we can maybe come back to the questions if that's okay. Okay. So just in summary then, nicotine replacement therapy can be offered in addition to behavioral interventions for vaping cessation. Really important to collaborate with the patient, determine that initial dose with this approach. So really walking through so that they have an understanding of how much they're consuming. Again, it is an estimate, but it's an idea or a way to work on a starting point. And if at all possible, follow up as a bit more frequently at the start, really to reassess tolerability with respect to the nicotine replacement therapy itself, and to assess how they are managing their withdrawal symptoms, if they are experiencing withdrawal. So the last objective, we'd like to speak to identification of some of the evidence-informed programs, and we'll also provide some of the provincial programs that we're aware of as well. So just to reiterate the importance of that first line approach being counseling, psychotherapy, and going back to the comments that were made from the young person, and really, I think with every answer that was provided, the emphasis on that peer influence, and really those approaches or those opportunities for one-on-one counseling or group counseling could definitively address the challenges that this young person is facing, and a number of young people do face with respect to the peer influence. Coaching or quit lines are also possibilities in terms of some of the cessation strategies, which were mentioned within the vaping resource from KNH. And there, in terms of some of the data, here is an example of text-based messaging cessation interventions, specifically the Truth Initiatives approach, which was this is from the U.S., and they used a digital text messaging program, and the program was called "This Is Quitting." The results from their intervention in terms of their findings, and they did see that they were able to achieve a vaping abstinence when they had compared their intervention group to their control group, and that the findings were significant, and this was over the course of 7 months. So this is some data in support of text messaging programs. They're also going back to the paper that I previously mentioned that looked at 1,500 students roughly. This data supports the youth perspective in terms of reported approaches that they have found to be effective. So here again, emphasizing peer support, which we don't have a lot of data to really suggest that this is effective. However, this is the youth lens, which I think we all know is a key and critical piece as we're considering strategies with respect to interventions. Internet-based approaches, again, mobile app and text messaging options. And I really do want to emphasize here that parent support was listed as one of the approaches. So briefly, there are peer support options, and this is through Health Canada. So we'll provide this information because this is an option that's available to all young people, and they can access a peer support approach that is web-based. There are also app and web-based programs. I think a number of individuals may be familiar with WASH through the Lung Health Foundation, which is now expanded. And so we'll be hearing more about the evidence supporting the use of this web-based or app-based program. And there's also Crush the Crave as well. And so going back to the parent perspective, again, just going to the point I was making that there was roughly 6% of the youth who reported that parent support was an important aspect to their treatment. And there, again, there's data that looks at the family environment that continues to be an essential venue for youth growth, and parental support is being documented as a critical protective factor for youth who use substances. And so we were fortunate enough to be able to acquire a parent perspective. And this parent speaks to the challenges with respect to navigating the healthcare system. And so we'd like to share their perspective here. And just to note that their young person is a grade 8 student.
getting a hold of any mental health assistance is not easy. It's extremely frustrating. Getting access to them, knowing what to do. The roadmap isn't very clear at all.
Oh, sorry. I was actually just going to say maybe there's a little bit more. I think it ends at 2:44. I don't know if we could just continue a bit to hear what he mentions there. Thank you.
It was months to get something together. We know why. We know the resources the system has. Our family doctor more or less said, well, you make your applications and wait the 6 months. So Patty has a familiarity in the systems. And she kept phoning. Eventually got contact with someone who was willing to help, who essentially got us into the program.
Okay, great. Thank you, Natalie. Okay, we are just getting to the end here. I'm just going to share the last few slides and then open up an opportunity for questions. Okay. So I guess maybe just as a reflection, I think we don't often have the opportunity to hear about the challenges, particularly for parents or guardians who are supporting a young person who is also treatment seeking. And I think it's important that we kind of think about that as we're considering approaches to support young people who are, in this case, treatment seeking, but even for those who might be contemplative but have a supportive caregiver involved with their care. So as I mentioned, in terms of this objective, the hope is to be able to provide evidence-informed programs. However, what we were able to find is that there are a number of programs across the province, increasing number of programs, and the data is really limited. So our hope is to, and we will, forward a list of these programs in order for you to have access and have at least a site where you can reference the programs, because there actually are more, I think, programs than even I think all of us in our group thought that we would find. And so I think it's important that everyone has this information, particularly as I think we're all anticipating that we might see a bit again of an uptick of the young people who are presenting for vaping related concerns. So really in summary, going back to the approach, we didn't emphasize a lot of the concurrent mental health concerns, but again, we know that there are often concurrent mental health conditions, even chronic health conditions, and that we need to ensure that we're addressing these concerns alongside the concerns related to nicotine use. To make sure that we're addressing that educational aspect, and then going back, just thinking back to what that young person has shared. So we will provide that information so that you can be able to, so you can refer to some of these resources, and particularly during like virtual visits or even in clinic, you can provide that information in hand for a young person. Then we've talked about first line approaches being that counseling and behavioral intervention. And then we've also addressed that there may be an indication for pharmacotherapy that would be alongside the psychotherapy and behavioral approaches. Support for caregivers, although not listed here, but I've just added that. I think that should be an additional prong here. And in addition to that, providing some anticipatory guidance with respect to reducing harms. The young person who did speak to not necessarily having a fair bit of success with reducing the amount of nicotine. So that was his experience, but there might be young people who have experienced, and I certainly have seen young people who've experienced some success with reducing the strength of nicotine and reducing the amount over time. So again, just thinking about other ways of tailoring care and providing some of that guidance as part of your overall approach. So in summary, nicotine use among youth continues to evolve, and ideally we should make every attempt to support a young person from a developmentally informed approach while we're exploring their use. The hope is that we're informing youth on the number of options available with the emphasis on our first line approach, whether it be counseling as individual or group. We can include text or web-based approaches, coaching, and hopefully even more increasingly peer support approaches. And lastly, providers ideally should remain informed about the programs that are local, provincial, that offer access to youth for interventions related to vaping cessation. So as we continue to acquire and collate evidence to encourage youth, or we encourage that we would use a youth-informed and multi-pronged treatment approach, which I've illustrated. And then most importantly, to continue to work towards engaging youth and young adults by exploring their reasons for vaping, their goals and motivations with respect to ideally reducing and even more importantly, stopping their use. So thank you. And I think we've got a few minutes for questions. So I will stop sharing my slides.
Thanks so much, Trish. That was an awesome presentation, and I know everyone really appreciates the knowledge and expertise you bring in this ever-evolving topic, and especially including all of the lived experience perspective. I think that's really appreciated. So yeah, we do have a couple minutes left for questions, so if anyone does have any questions before we head out, please do put them in the chat and we'll try and address them.
And in the interim, I just want to also just say a huge thank you to Natalie and also Sarah and a number of members of the team. I know that you've worked really hard to try to make sure we've got some of the more up-to-date information and the videos, and thank you to the patients and the families that were so open and honest and were willing to provide their stories, which I think we can attest to the fact that it was very powerful to hear their narratives.
For sure, yeah.
So I'm looking in the chat too. Oh, okay. I see a question about follow-up with a 21-year-old who was vaping since 16, quit last week using Nicorette. Trying to see if I can get to his hardest time is after work when he's not distracted and especially trying to fall asleep. Feels his chest is already less full. And is clearer and is saving money. Happy for the follow-up. I'll touch base in 2 weeks and he'll let me know if he needs more gum. That's great. We'll discuss weaning off the gum in the future. Wow, that's fantastic. That's great. Thank you for sharing that. That was Mercy. I don't see actually, I don't know if you see any questions, but I don't see any questions. Again, we'll share the content and provide those resources in terms of the programs and what was requested in terms of the resources for youth.
Awesome.
Okay.
Oh, there is one question if you want to.
Yeah, for sure. I can't see it.
Norma says, do you find most of your clients need NRT?
Majority, I'd say yes. And I would say it's quite variable in terms of how they incorporate NRT, which I think that's really speaks to the importance of tailoring the treatment approach and understanding the context and really understanding the whole person.
There's a couple other questions. I know we're running out of time, but.
So among different approaches discussed, would you suggest which is best for a 14-year-old who is vaping with peer atmosphere. So I would go back to actually what our young person has shared with us. So that assessment being important in terms of the comprehensive aspect of the assessment. All those questions that I kind of added in towards the end around motivation, why they're using, why they continue to use, they may actually point to the peer influence. They may not, given if they're 14, particularly if they're developmentally a bit more concrete and more in their early adolescence, they may not recognize the peer influence. So this young person might be motivated to start NRT, but really the behavioral interventions will be key. And the hope is that there's some degree of engagement, and it may not be specific to vaping cessation. We might have to find some other way of engaging the young person. So that would be the approach, generally speaking, that I would think about, is really the engagement over time. And incorporating aspects that seem appropriate for the young person in terms of working towards their goal, which we hope is cessation. If there was a question about recommending Alan Carr's easy way to stop vaping, I would say that I wouldn't provide a recommendation that is specific to any program per se. I think in general, what we would hope to do is provide the approach, and we're really looking at this point to think about evidence more broadly. And then going back to what was mentioned is really tailoring that approach. So if that is appropriate for a young person that you're seeing in clinic, then I think at this point in time, really, that would be the way, and I think a number of people would agree that that would be an approach to take, and then just ensuring that we're weighing risks and benefits.
Awesome. Sorry, I'm just gonna.
Oh, there's one more question towards the end.
Okay, yeah.
That says, is there any way we could incorporate some of these behavioral interventions into health curriculum for students? I think that's a great question, and probably I would hope that will be part of kind of some of the steps that will be considered. And I know that there's certainly with the Lung Health Foundation, the QUASH program, that they are looking at that aspect in terms of incorporating more within curriculum. But I would agree. I think that this needs to be a part of the discussion, and this is where we're heading with the vaping, with instituting the vaping ban and the consequences, etc.
Thanks so much, Dr. Tillich. Are you okay if we wrap up here?
Yeah, I think that sounds good. Yeah.
Awesome. Well, thank you so much again. This was such an informative webinar. As you can see from the chat too, everyone's really appreciated your thoughts and expertise on this. So yeah, just a couple of reminders. If you need to head out, please do. I'm just going to go through some housekeeping reminders again. So just want to let everyone know this webinar has been recorded, and we'll be distributing a link to it, the recording, as well as the slides to you all by tomorrow. And please feel free to share this with your colleagues or clients as needed. Along with this, I will also be sending a link to the evaluation and post-learning assessment that must be completed by next Wednesday to receive your letter of completion if you're interested. We also just want to take the time to let you all know about our next upcoming webinar on September 25th, which will be on cytosine. So keep an eye out for registration opening up soon for that. For now, if you missed a portion of today's webinar or would like to view it again or see a previous Teach webinar, an archive list can be found on our website as always. So that's it for me. Thank you all so much for listening and participating today. We hope you all have an amazing rest of your day. Thanks, everyone. Thanks, Dr. Tillich.